So a skeletal muscle has different levels of organization. The broadest category is the muscle system, which is an organ system. Beneath that is the muscle, which is an organ. After that is muscle fascicles, which are tissue. Muscle fibers are the cells of muscles. Myofibrils are the organelles. And lastly, the myofibrils are made up of thick and thin filaments. The thick filaments are myosin, and the thin filaments are actin filaments. Myosin, if you remember from Bio 105, proteins can be made up of several different polypeptides and a quaternary structure, and what I will talk about in this article are the isoforms MHC1, which is the myosin heavy chain 1, and MHC2, which is a myosin heavy chain 2. So this is just an overall view of a skeletal muscle. As you can see, the broadest form that they show is the skeletal muscle, which is the organ. It's covered in epimysium. It's made up of bundles of muscle fascicles. In between, there are blood vessels that can carry nutrients and oxygens to the muscle. Further than that is the muscle fascicle, which is tissue. It's made up of a bundle of fibers. These fibers are connected through the endomysium, and they are covered in the perimysium. So the endomysium covers each individual muscle fiber. As you can see, skeletal muscle is multinucleated. It also is made up of the organelles myofibril. So myofibrils are 1 to 2 micrometers in diameter. They're made up of myofilaments actin and myosin. The actin and myosin make up a sarcomere, which is the basic unit of contraction of muscle. Atrophy is a decrease in muscle mass. It can be caused by 2 different things, either just a disuse of muscle. If someone isn't regularly using muscle, then the muscle mass can decrease. Also, denervation, when a nerve is damaged, therefore it prevents a muscle from getting stimulated and disallows someone from using that muscle. Osteoarthritis is a joint disease. It can either be from a genetic mutation that causes abnormal collagen formation, or just from daily wear and tear, which is usually seen in older people. In this in this experiment, there was a control group and the experimental group. In the control group, there are 8 men and 7 women without osteoarthritis, and also in the experimental group, there are 8 men and 8 women with osteoarthritis. The main reason between this is because it was thought that the control group would exercise more than the experimental group, because the experimental group would be experiencing pain when exercising due to their osteoarthritis. They wanted to have a strong correlation between atrophy and what they saw in the muscle samples, so they made sure that their participants were somewhat similar in characteristics such as age, height, body mass index. They also made sure that no one was experiencing things such as heart complications, because that would play a role in the way they exercised. So all the volunteers wore accelerometers that measured their physical activity over 5 days. Then all the volunteers had a percutaneous biopsy of the vastus lateralis, which is the largest muscle in the thigh. This muscle had, this tissue then that was removed from the muscle had to be processed. It was placed in a dissecting solution. Muscle fibers were carefully dissected and tied to glass rods at slightly stretched lengths and chemically skinned. In order to find the subsarcolemmal mitochondrial fractional area, the average area and the number of SS mitochondria found in a sarcolemma, an electron microscope was used on the skeletal muscle fiber bundles that were obtained from each volunteer. It didn't actually say how they found these numbers, but they referred back to a previous study. In the previous study, it said that images were taken along the sarcolemma in random locations, and then the SS mitochondria were then counted in each area. The other experiment I was going to talk about, it was found the myonuclear number. This was found by using immunohistology. What they did was they used their frozen tissue sections and they fixed it in PBS for 10 minutes. They also added methanol for 15 minutes to reduce the autofluorescence. Goat serum was also added. More importantly, though, the tissues were incubated for 60 minutes with rabbit anti-laminin antibody and also mouse anti-MHC1 antibody. And then after that, the tissue samples were also incubated for 60 minutes with secondary antibodies and stained with DAPI. So the reasoning behind this was that the rabbit antibody would bind to the laminin in the muscle, and also the mouse antibody would bind to the MHC1 within the muscle, and that the DAPI would stain the nuclei within the muscle cell. In order to see this, an Olympus BX50 microscope was used. Also, image analysis software was used to actually measure the amount of MHC1 in two fibers. So what they found was that, as you can see here, the women are on the left and the men are on the right. The white is the control, and the black is the experimental group with osteoarthritis. The bar that extends across the whole graph shows that there's a difference between the men and the women, and the bar across these two show there's a difference between the control and the experimental group and the women. So there was a difference in SS mitochondrial number content along the whole length of the sarcolemma, which is what A shows. In B, it shows that there was a difference between men and women of the SS mitochondrial content per sarcolemma length. Also, there was a difference between control and the experimental group for the women. Lastly, there was a difference in the SS mitochondrial per sarcolemmal space. The sarcolemma space is actually defined as a space between the sarcolemma and the first layer of myofibrils. But there, however, was no change in the size of the SS mitochondria. So this was what was found when they performed the immunohistology. The red, as you can see, is the MHC1. The green is the laminin, and the blue is the DAPI. The blue actually symbolizes the nuclei. So then software was used to quantify the MHC1, and it was found that there was no difference between the control and the test groups for both MHC1 and MHC2. So these are the conclusions that came from the results. One reason they gave for women having a greater SS mitochondrial number than men is because that in women, a higher SS mitochondrial number actually shows positive phenotypic changes, while in men, it actually shows negative phenotypes, especially when the subject has experienced disuse of muscles. Also, despite their hypothesis that there would be a difference in the myonuclear fibers between the control and OA group, this study actually showed that there was no difference, and that the MHC1 and MHC2 were not affected by muscle atrophy.